Well, I'll call the Fitch-Rona EMS Commission meeting to order at 7 o'clock. Michelle, can you do a roll call?
You bet. Strassman. Here. Hilla. Here. Roberts. Cronin.
Present.
Johnson.
Here.
Miller. Lonsdorf. Schnapp.
Here.
Lugenbull.
Here.
Anderson.
I'm here.
And Deputy Chief Dost-elect is not here, I'm assuming.
Correct.
Okay,
Thank you.
you're welcome.
Do we have any public comment? Did we? I guess not. Let's go ahead to review and approval of the meeting minutes from August 19th. Is there any corrections? If not, a motion to approve would be in order.
Move to approve the August 19th, 2021 minutes.
And a second.
I'll second.
All in favor of approving the August 19th, 2021 minutes, signify by saying aye.
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 Any opposed? The minutes from August 19th, as submitted, are approved. Patrick, want to go ahead to the chief's report?
Sure can. Yep, this all got emailed out to you. Just the thing to note again is what we've seen for a while. So we did 375 calls last month, which is, I believe we went back 1 year. So that's the second highest number we have ever seen. Again, just pointing that out, that is a 21% increase from the year before, bringing our average for our year up 14% increase in call volume for the year. If this keeps on, we will hit 4,000 calls this year. I wasn't planning on that for about 2 more years from now. So as we continue to move forward, our staff's been doing a phenomenal job. So they've been getting their backside handed to them some of those days, but they're doing a phenomenal job, and we keep checking in with them. They seem to be doing pretty good. So they're working hard and keeping everybody covered. A couple days we've said, of all things, DeForest was actually in Fitchburg the other day as the closest ambulance to help us out as they were coming back from the hospital. So it's been crazy. And we've had a couple days like that. So I'll just continue to keep reporting those numbers for you, but they keep going up. Everything else is pretty par for what it is. The Fitchburg still is kind of seeing tendency to see a little bit more calls up there than we have in the past. Our fractal times are just fine. As you see, we're up to about 11 calls per day. We have a sepsis training was our training for the month for our internal training. We did help out with the Little John's fundraiser there a couple weeks ago up in on Verona Road. And then we're back in full swing with fall sports with the cross country invite a few weeks ago. Football games on Friday nights. We have another had a cross country meet this last Thursday. Helped out. So we don't actually, Ironman doesn't contract with any local services. I do upstaff that day, so we put another truck on that day. So we put a truck on for about fourth truck on, roughly about 10 hours. Primary reason for that, not for the athletes, but the route for the bikes, the bike in Ironman literally divides Verona in half. And the only way to get around that is the 18151 bypass. So we actually put on a fourth truck that day and put them on the west side of Main Street, keep the other one on the east side of Main Street. I think we transported one, and I think saw 2 or 3 injuries from that race. So that's another race another event we supported here just last weekend. As far as calls by the day, they hopped up a little bit on Monday. No one wants to go to work. So everything else is pretty powerful where it's at. Our usual calls for service, same thing, flipping all around with that sick person and falls. It just flops back and forth every month. And then, as usual, predominantly station number 2 is running most of those calls. As far as our aging financials of that run volume that we saw kind of creep up there over the last few months, we're actually starting to see that now, as you can see, as far as our financials are about those 30, 60, 90 days out, those percent wise, they're where they should be. But those dollar amounts are higher than we tend to see. So we'll keep an eye on that with Brad and our Three Rivers, just to make sure that we keep all of that where it should be. That 30 to 60 days out, I think they're just kind of playing catch up there. So we're still within our ballpark. Checking marketing, savings, and CD are all posted there for you. WISC funds, we got our whole $4.38 in interest. While we're talking about the WISC funds as part of the Chief's report. So I did reach out to Sarah, who is our, I guess, financial advisor, I guess, through the WISC fund. As we saw last month, we actually got a really good rate of return on that two-year CD that we had purchased versus what we're seeing every month here in that essentially that kind of that market account. Met her a few weeks ago. So next month you're going to see a change in the WISC funds. Is really a bookkeeping thing for us to keep that 24. If you remember what we have in our WISC, most of that is our there's two pots. I'll scroll down a little bit farther. Is the post-retirement healthcare fund, and then we have the labor contract fund, which we're actually going to have to tap into next year as we have contract negotiations next year. It was really a bookkeeping thing for us to keep them separate. We knew we weren't going to have to touch the labor negotiations contract until next year, versus the sick time, that post-retirement the post-retirement healthcare, which the liability exists over the course of the year. I have that all plotted out, every employee, how old they are, and we kind of make some assumptions based on historical values of when employees are leaving. So that fund we have to keep mildly accessible based on, I believe the number is like 4, as of today, potentially 4 employees could retire, and we would have to pay that retirement out for their sick time. So again, we got to keep some of those funds fairly fluid so we could access them. So again, it was just a bookkeeping thing for us. What Sarah did for us, and you'll see this next month, we actually put it all in one big pot and we dispersed it. So we actually took, you'll see the real numbers next month, but roughly took about 100,000 of that and actually put it, the whole 100,000, in a 2-year CD, leaving us about another $100,000+ in a 1-year CD. So even if we have an employee who retires next year at some point, most likely we've got some operational funds that we can use until that 1-year CD comes due, and put that money back into our operational fund. So again, a little bit of fluid finances there versus the better rate, which we got a really good rate on it because it was a good rate 2 years ago. There's no such thing as a good rate anymore, but it's better than what it could be versus the 1-year versus 2-year. So just giving you the heads up, you're going to see that those amounts change next month, and we'll reflect them on here. And I'll be checking in with Sarah again. We check in probably every 6 months to a year, but just kind of emailing or phone calls, making sure that we're putting funds where they should be. Yeah, so those numbers are reflected there. The ambulance purchase, those funds are still there. We're just going to talk about that in a little bit. FAP funds, I just submitted our FAP. That's our funding assistance program to the state. So we get some state funds based on, it's a formula of our population. I think our population and our volume and our roster. So I just put that submitted the request for that. We usually see that in a couple months towards the end of the year. Those funds are again restricted. I think I've explained some of this to a handful of people. Those funds are restricted on what we can use them by. That's dictated by the state. And then you'll see, as I mentioned last month, the bike medic fund is gone. We put that into our operational account to purchase uniforms and bike maintenance for the recent Alliant Energy Center events, and then the anti-idle stuff went towards our ambulance. I will pop in here that we actually were awarded our kind of the EPIC annual grant that we submit a request for equipment or whatever we want for. Did get that confirmation on Monday that we actually did get some funds for 2021. That check, I think next week it gets presented to the city. A lot of times they mail it straight to us, but it comes about the same time. So we got $42,000 from Epic this year. What I asked for was another Lucas device, so that's the mechanical CPR device, and then I asked for 2 more ventilators. So what that will actually do is put 5 of essentially 5 CPR devices and 5 ventilators. Once we get these things purchased and put them in our trucks, we will actually have 5 identical ambulances. Sort of one ambulance that doesn't have a power lift in it. That will be our oldest one, and I kind of, depending on how that matter, or how long we keep that, I think that's probably a good conversation to have. But beyond that, we have 5 identical ambulances. So as far as staff,
Cool.
they literally could move from one ambulance to the next without having to. Garage door openers would probably be the only. We would benefit some garage door openers because we always forget the garage door openers when we switch trucks. But beyond that, that stuff was ordered today. We'll see that money in a couple of weeks, so you'll see another line item there. But a huge shout out and a thank you again to Epic, a huge supporter of us every year. No milestones, no donations for this month, and there's the comparables for us. Talked about the WISC stuff, and we talked about the Epic grant. Let me pull up the current operational budget for you. So this is where we're at with our current spending as of the end of August. We're 66.6% of the year. As expected, our run income, as I've shared with you about the budget stuff, overestimated run income for the year, so that isn't known. So we know that we're under there. That's what that number currently is. As I mentioned, just because of the sheer volume we've been doing over the last few months, that I'm pretty sure we're not still going to meet what that overestimation was, but that number is going to reduce as time goes by. As far as other income, working our way down, that's about it. As far as expenses go, we're pretty on par for where we should be. I've explained kind of in the past those things that are over that 100+%. Our wages, as you can see, that overtime is a little bit. It's at 71%, 58%, 66% this far through the year. One of the kind of, I don't know, things we struggle with, but keeping in mind with that is, so when we do all the Alliant Energy events, or do any of the standby events that we do, we contract out for those for 100% of we figured out the cost, right? So we get 100% reimbursed from that, but we still pay it out of a salaried line. So even though it looks like we're going over salary, all of those events that we have are actually reimbursed. So we're still sitting well with our salary lines. So at the bottom of the page, you're looking at our total expenditures for the year, and it says we're 67.1%, and we're only 66% through the year. Roughly, the chart here shoots us at $10,000 over budget. However, always one of the explanations to look at, even if you look at that computer support line that says we're estimated to be $8,000 over the computer support line, all that is a math calculation that says you've spent this much this far at 66% of the year. This is probably what we're going to spend for the rest of the year. We had 2 cases of viruses, or people's emails being hacked, so that cost a little bit more. So that's not a true forecast. We use computer support when we need computer support, not that is a reoccurring monthly thing that we see. One thing that we do know, as I've shared, we have medical supplies. As has been the last 2 years, we will most likely be over, as well as tune-up and repair costs. Just seeing, again, some ridiculous costs on routine repair stuff. So even if I take that $8,000 out of there, this estimate has us $2,000 over budget. Still have a couple months left in the year, so sitting pretty good as far as expenditures. Close that tab. Close that tab. Only other thing I have for our chief's report is just wanted to do just kind of a quick clarification. So when I brought up the budget last month and we looked at the equalized value and kind of the percents that went off, and stressing the kind of to the commission to the rest of our municipalities, we really cut the budget. I looked at this, right, and we essentially took out anything we possibly could to keep that volume, to keep that amount down. Did mention retirement being an option to take the funds from there, what little reserve we had, and I actually did mention at the time about reducing staffing. Kind of went out there and wanted to make sure that the commission knew I'm not a fan of reducing staffing, as you can see from those numbers there. All of our municipalities fought pretty hard, gave us that option to put that ambulance in place, and we did. So just really wanted to stress that though I brought it up, not really looking at it as a viable option. Completely understand if the communities come back and say you have to do something, we will figure something out. But I just wanted to make sure that that message was relayed. Don't really look at that as a viable option. That is truly a last resort option for us. But that's what I have for a chief's report.
Okay, thank you, Chief. The Personnel and Finance Committee, I believe, did not meet, so we'll move on to a review and approval of the accounts payable checks as submitted by Chief Anderson. Were there any questions about any of the items?
Terry, could we
Yeah.
go back a second to the chief's report? I wanted to ask the chief if he has any explanation for why the run volume is up so much.
Sure.
Is he or anyone else that, you know, on the staff?
So we actually look at that, and we've actually been asked that and asking ourselves that, and have not a clue. Truly, the makeup of our calls is the same. We're not seeing any more sick people. The sick and the falls complaints flip flop essentially every month. It potentially could be COVID related because we don't track COVID calls anymore, but it would truly be a guess. We're not seeing any specific complaint. We're not really seeing any specific areas, not even really based on municipality. We're not seeing more trauma. We're not seeing more violence. It's truly, as far as we can tell, you know, running all of those statistics, it's just volume.
And I can tell you that the hospitals, we are all diverting to each other. We have been above capacity consistently for 3 or 4 months.
Is that related to COVID?
Not necessarily, no. Our COVID numbers are up in all hospitals, but not to equal the amount of patients that we've sustained the last 3 months.
Well, and you know, in our hospital too, we're having a hard time getting people out of the hospital. You know, we've had a lot of really high numbers too, and we just can't get them. You know, usually we can get them in and out, and we have a lot of people that have been staying. We're over like 300 and like 311, 319, and we've been consistent too for the past couple of months. And it's not all COVID. We actually have seen in the last week, some of the COVID patients have gone down, you know, which is good, but it's a lot of other sick people.
So that was a long answer to I don't have an explanation.
Well, I guess the question was really designed to ask whether this seems to be sort of a short-term trend that's going to go back to, you know, normal, or whether this is going to be something that will continue to increase year after year. And again, I guess we don't know, but
Yeah, my assumption, we've seen spikes like that before. We you know, if I go back 1 year, 2 year, and you kind of see it from the report there, we were having months, you know, spatterings where we would hit 300, 310, 312 calls. But it was a month or two in a row, and then it would go back down. This has been sustained over 325 some calls now since March.
Yeah.
So to me, this is a trend. I would think that it would go back down, but we're not seeing it go back down. Not a cause for concern, but continue to bring it up here as with the municipalities all the time of this. I didn't expect to hit 4,000 for probably another year or two. And then in September of next year, when the town is acquired by Fitchburg and we put another 300 or 400 calls in there, we're growing by double. We're busy by double-digit percentages. So it may, right, we might get a snowstorm in a couple of weeks. It'll go back down. I don't know. So we'll continue to share the information with you.
Bite your tongue. We're not getting snow in a couple weeks. What's the matter with you?
Okay,
All right, thanks.
yeah, interesting. Moving then back to the accounts payable checks, I guess if there's no comments, motion to approve as submitted.
This is Derek. I just had one quick question. Is there anything on here that's out of the ordinary? Chief?
Nope. I signed them all. They all look good.
Sounds good. Thanks.
I don't think, yeah, because the ambulance was on last month. We did submit our last checks, our last invoice to the municipalities for the last part of the ambulance purchase for this year. I think it's pretty spot on that what I request for, and I think we were probably about $3,000 under. Because I think we were able to reuse a couple things. So no, the
Okay.
answer is no.
Thank you.
I'll make the motion to pass.
Second,
accounts
Lonsdorf.
payable.
Okay, all in favor of approving the accounts payable checks as submitted, signify by saying aye.
Aye.
All right.
Any opposed? The accounts payable checks as submitted are approved. We'll do the Gatsby 54 revisions.
I remembered to do it this month. So it's playing catch up. It's the usual language. It says that you all have some assigned funds that you want to keep in the identify what's sitting in our general fund for different purposes. Those inventory and prepaid expenses come from our auditors every spring, so I don't touch those. And then the FAP, the sick leave, the contract negotiations, and ambulance purchases is what we just saw. So this will be different this month from previous months, as the Epic bike grant and the Epic the previous Epic grants, both of them are no longer listed on here as those accounts are spent.
Okay, thank you.
And I will need to change. It says June 2021, but that should be September.
Oh,
Right there.
yeah, okay. Well, you'll correct that, I guess, and motion to approve the Gatsby 54 proposal for submittal.
I'll move to approve Lonsdorf.
Second,
Second.
all in favor? Signify by saying aye.
Aye.
Anybody opposed?
And that's what the date change, right? Yeah.
Right.
Yeah.
Okay, the Gatsby 54 report as submitted is approved. And Chief, you want to move on to funds from the ambulance sale? I guess we had a good sale this time.
We did have a good sale this time. So historically, we budget we continue to, the next ambulance purchase, we budget $5,000 from the sale of the previous ambulance to be placed towards the purchase of the next ambulance. Kind of a one-off this year. The ambulance that we put out to auction was actually in better condition than most of the ones that we usually sell. It actually low miles, right? It had 99,000 miles on it, which is low for us or any ambulance that we have previously sold. And again, in pretty solid condition. I think the other component of that is, I think as I have shared, the current purchasing of ambulances. If I want to buy one, if I order one today, I'm not going to see it for about 12 to 16 months. So it actually, when we put it up in the auction block, the ambulance actually sold for just over $22,000. We anticipate 5 from that. Other thing that you see every month is the CD that's still sitting there from the $9,000 from it was actually the previous ambulance purchase, and then we actually, because we replaced, I think it was 2 cots and a couple other things. So the CD is actually sitting there with 9,000 and not 5,000. So retaining 5,000 of that for the 2023 ambulance purchase, that still gives you roughly about $30,000. That is an unanticipated potentially source of income from this year. So it's up to the commission what to do with those funds. Again, historically, the sale of that purchase goes to the purchase of the next ambulance. So I explained it in the email. So there's essentially three options. We can take the roughly $30,000 from that ambulance and apply it to the 2023 purchase, which would reduce the CIP request in 2023, which usually tends to throw things off more than it helps. But that is one of the options. Option B is actually to take those funds and leave them in. Essentially what you would do is we would identify 5,000 to be an assigned fund for the 2023 purchase. And because of the current hiccup we've had with the budget process, we can actually take those $30,000 and put them in that general reserve fund and start to build that back up without having to ask the municipalities to help build that back up down the road. Third option is actually we could take that money and apply it specifically towards the 2022 budget, which would reduce what we ask the municipalities for. So again, roughly $30,000, but remember that's divided based on equalized value. So of that 30,000, Fitchburg would get 60. The city of Verona gets 40% for like 30. I'd have to go back and look. It's like 55, 40, and hold on. Of the $60,000, Fitchburg would get 53%, city of Verona would get 41%, and the town of Verona would get 5%. So not all one municipality gets the 30,000. You split it like that. So, big picture stuff, Fitchburg gets just 15 to 20,000, and it gets broken down like that. So I guess I would open it up for discussion of what your thoughts are on that.
So Patrick brought this up when he presented to the City of Verona's Finance Committee on Monday, and their feeling, including myself, was the best way to direct these dollars was to put them back into the reserve fund, because splitting them among the three municipalities is really going to be a pittance and isn't going to help the budget all that much. And the reserve fund has taken quite a hit. So anything that we can do to bolster that, in our opinion, is the best way to use that money.
I agree.
If we were to use that money for the budget, would it prevent having to ask any of the municipalities to increase their amount for the year?
That again, what it would do, I would plug it into a miscellaneous line item, and that $30,000 would come off out of the operating cost, the overall operating cost. So it would reduce, whatever the math works out, it would reduce Fitchburg's contribution of those numbers. So right now we're asking the city of Fitchburg for $936,000. It would reduce that by $20,000, $18,000. I think that's where Kate was referencing $936,000 and just taking $18,000 out of there. It probably does not reduce that by a single percent versus actually just taking the money and putting it back in the reserve and helping long term. Because eventually, though we have a couple of ideas out there about how we start bolstering that reserve back up, this would be a step towards that.
Yeah. What does Fitchburg think about that? Any preference?
I'm about putting it back in the reserve. I think we should do things in the best interest of the long run instead of the immediate.
Okay, Dave, you comfortable with that too? I guess.
Yeah, for the town of Verona, it wouldn't end up being that much money returned to the town, and it's better used to bolster the reserve fund, I think.
Kind of sounds like there's a consensus then that we should put it in reserve fund. Is anybody kind of disagree with that?
No, and it comes with a recommendation from the finance committee too, it sounds like.
Yeah,
So yeah, it hasn't gone through the Fitchburg Finance Committee. I talked to them, I think October 5th is when I do my presentation to the Fitchburg Finance Committee. So that was the Verona Finance Committee when I met on Monday. It sounds like that's the consensus unless there's more discussion. So I will actually, because I need to find specifically where it is. I think it's a policy. It might just be like what we've done about what it says we do with those funds. So I think I do need to put a resolution together for you to provide that guidance, because I think it specifically says the sale of an ambulance will apply towards the next sale of an ambulance. So what I will do is our annual meeting is next month, which we'll talk about. I'll put a resolution together for probably November for you to essentially approve to direct where those funds are. Until then, they'll just go in the general fund.
okay, sounds good. I want to move on then to the 2022 rate proposal.
Let me get it open for you. I can zoom it in a little bit as well. So I emailed this out to you today. Sorry, it was a little delayed in getting to you. I meant to get it to you earlier, but I was waiting for some last information. So traditionally, again, every 2 years we review our rates. So 2022, starting next year, would be we review it this year to be effective. It would be January of next year. What you'll see is our Fitch-Rona rates historically, and about every year or 2 years we update those. We kind of skipped a year there, but we're currently, you'll see what our current rates are. What you see on the right hand side then is what area paramedic services. Our greatest comparable would be Sun Prairie is the equivalent to us as far as size and volume. Middleton does a little bit less. Madison does a whole lot more. Deer Grove and Monona, both paramedic services who do significantly less than what we do, but you'll see their rates up there. Always pros and cons. We can increase our rates all we want. Medicare and medical assistance are only going to pay what Medicare and medical assistance pays. So as I've kind of presented on budget explanations, we raise our rates. We tend to see for a while, we tend to see our recovery rate or our collection rate go down a little bit, right? Our income always goes up, but our collection rate goes down. Just the mere fact is what it is. As we kind of discussed earlier in the year, as we revised our hardship process, there's always an impact because medical assistants pay what they pay, insurance pays what they pay, and then people who do not are under or uninsured, this entire balance falls to them. So there's always the risk of that when we raise our rates. However, we also have a service to run, and it's not free. So I guess looking at what the other services are provided. So I did do a rough kind of threw some numbers into the formula, the corrected formula that estimates run income. It potentially would be about a $50,000 increase in run income than what is currently budgeted for next year. My thought would be not go back and correct that and send that new number out to the municipalities, though I think they would prefer that. I guess to me at this point, because right, as David said, the nature of what we do is completely unpredictable. We could go back to doing 250 calls a month, and that's what next year could look like. So I guess given our kind of current state, I would prefer to leave our run income projected as it is, which is a pretty conservative amount. It's realistic, but it's a pretty conservative amount, and not overestimate by $50,000 to $75,000 next year with the assumption that we're raising rates and we're going to see 4,000 calls, and that's what it's going to be, and then find out next year that we didn't do 4,000 calls, and then we're back into the situation we are by any means, but that we're kind of still under where we wanted to be. So I guess my suggestion would be, and that was plugging it in with a $100 increase on a base rate and for resident and a non-resident, roughly $50,000 more. Whatever, as you can see, some of our area services, it is more than it is more than $100 for either that base rate for a resident and non-resident. It's upwards of $200 and $300 more. And you always have that option as well. But I guess my suggestion would be you choose some sort of rate increase effective January 1, but we still don't go back again and change that towards and apply it towards next year's budget. And then next year, when we actually, we got 6 months into the year and we still see that this trend is going to continue, then there's a solid, reliable approach then to saying, all right, now we can reliably raise that estimate of what run income is going to be based on these new rates for 2023, and hopefully bring that cost down to the municipalities again a little bit next year, if any of that made sense. So again, the math I did was raising base rate, a resident and a non-resident, by $100. But as you can see, that is still from Middleton and Sun Prairie, we are still far less than them, even by raising it $100. Not that I'm a huge fan of perpetuating the rising cost of healthcare by making it higher, but.
So Patrick, I agree. I'm not a fan of that either, but I think we're looking at a reality where we really are going to have to pass some of this cost off to our clients. I know that we aren't as big as Middleton, but if you look at, median income for the city of Verona and the town of Verona, for sure, I would be more comfortable in looking at numbers like Middleton's. I mean, it's just a financial, unfortunate reality. And I'm glad that we have the, hardship policies in place, and certainly welcome and entertain any submission for that, because, I don't want this to be something that bankrupts people either. But I think the vast majority of our clients would be able to shoulder a higher cost.
Any other discussion?
Well, I guess I would kind of disagree with that. How do you know people can shoulder a higher cost? And what is the Middleton and Sun Prairie rates based on? I mean, most businesses calculate their cost of their product by what the market is, but also by what it costs to produce the product. I don't see any kind of analysis like that here. All we're saying is, let's just go up some. And as Patrick said, it's basically borne by, medical costs like this are borne by people who don't have insurance, largely, because everybody else, either Medicare, Medicaid, or insurance coverage, will pay, like Patrick said, what they pay. The people that actually pay the rate that we come up with are the people that don't have any insurance at all. And they're the people that are least able to pay.
My understanding from the Middleton and Sun Prairie chiefs, and this is when we looked at this 2 years ago, we were all pretty similar in 2019. In 2020, I think, or similar around that time frame, is when they made a pretty significant jump, as in like $200-300 up. So since we looked at this 2 years ago, I believe Middleton and Sun Prairie were at 14 and like 1450. So they have actually raised it every year since then. My understanding it's part of it is they looked at same thing of market value of City of Madison was $1,275, and part of the challenge of Medicare reimbursement and all working together with each other is they look at, well, what do people charge in your geographical area, which is huge, and it's always been kind of a problem with the EMS world of comparing us to Belleville, which I believe they finally started charging. So, we're next door to an ambulance service that charges nothing, and then we're charging $1,100, and Medicare says, oh, let's meet in the middle. It's way more complicated than that. But I think that was one of the drivers of them raising that cost is kind of to, if they push the cost, then ultimately sort of kind of Medicare follows. Medical assistance next year, I don't know what the total number ended up being, but no medical assistance for EMS next year will be raised significantly as far as a reimbursement rate. it doesn't apply here. It will still be far, far less than $1,100, but it will be more and help out a little bit.
Is the $1,100 based on, I guess, again, at what Dave was talking about, what it actually cost per run?
No. All it's been historically it was $400 and then it was raised to $450
So
and that
it's
was
just it's more
$500.
historical than
Raised to
cost
500.
driven.
Yeah, we if I take 4,000 or 3,505 calls of what we did last year and the entire income we got last year, an average call costs, I shouldn't say an average reimbursement on a call is $424. I don't know that I could break it down and say what an average cost per call is. I mean, I could try to figure it out, but it changes. If we do 4,500 calls, that's less. If we do 3,000 calls, it's more, but it's more gas, but it's more time. You know, I've mentioned it before. I don't wish death and destruction on people, but idle ambulances don't make income. So you know, it's something. We'll never make a profit. Having an ambulance service, we're there to provide a service, and that's borne by the taxpayers. Charging user fees helps alleviate some of that burden to the taxpayer.
Yeah. Well, if you look at our total budget's about 3.2 million. And if we make 400, we get 4,000 calls a year.
I can tell you exactly what that number is.
It comes about $800 per call for what it would cost. That's rough. That's my rough estimate of what it costs to respond to each call. If you look at what our total budget is.
For 2022, user fees will be 47% of our budget. The municipalities will bear 52% of the cost of an ambulance.
Yeah, I was just trying to get at what the actual cost is for an average call, which would be about $800. That kind of gets at what Dave's talking about. So I don't want to say we're overcharging, but we're overcharging some because others aren't paying the full cost.
Yeah.
That's the reality of it.
That's the way medicine works. It's called usual and customary fees.
Right.
And that basically just means it's what we charged last year, and then we add a little bit to that. And I've noticed that medicine basically goes up 10, 12%. The cost of insurance and cost of medical care goes up 10 to 20% per year, when inflation is really only going up 2 to 5%. And it's never made any sense to me. And I'm not picking on the ambulance service, but it's, people just sort of pull numbers out of the air. If we go up $100 for the base rates for the resident and non-resident, that's more or less a 9% or almost 10% raise. I think that's more than inflation. I understand the rest of it is being borne by the taxpayers of our districts. But if you look at police and fire service, we don't really talk about it that way. We talk about all of the cost is borne by the taxpayers. So, it makes me wonder, why is the ambulance any different? It's just because people have insurance, and insurance will pay some of it.
Yeah, interesting.
I mean, it's not an easy question. It'd be easy to resolve it and just say, let's do $100 and move on. But I think that kind of thinking just leads to us. It's sort of like printing money. It just is sort of saying, let's just charge more. But really, it's not going to necessarily result in a whole lot more revenue. It results in a lot more people being sent to collections in some cases. So.
Chief, what did you say the percentage of the 22 budget, the budget that is made up by user fee?
47%.
Thanks.
Roughly what percentage is not covered by guess I'm trying to get what percentage of the people we serve aren't covered by either Medicare, Medicaid, or insurance?
I can find it.
Pretty
I can-
small percentage, right?
I can find that information. I don't have that information readily in front of me. It would actually be, so actually I can find it. It's in the annual report that we put out every year. So
Yeah. Okay, I guess I can look that up. Another quick question, I should know this, but does insurance pay the full rate?
it all depends on what you got. If you
So
pay-
Blue
if you pay a
Cross
lot,
might pay
you're-
one thing and,
Everybody's different. Some insurance covers all of it, some has deductibles, some covers half of it, some covers none of it.
so these rates really apply to a very small percentage of the
He said
people we're serving.
Well, I think with insurance, if they cover, 80%, then doesn't the other 20% go to the customer or the user?
yes, yeah. So
So
if-
they-
yeah, yep. Unless it's a government, Medicare, medical assistance.
Yeah, those are
workers' comp,
contract, yeah.
there's a couple of them there that we are required to write off the balance. Otherwise, yes, it's rolled over to the patient. And this is something, again, we don't have to decide it now. It's something that gets implemented by January 1st. If this is something you want to table and come back to in November, if this is stimulating more questions, that's why I put the possible.
Well,
action thing.
I'd like us to think about it a little bit more. I'm not sure what basis we're going to be thinking about it, but I've seen this again happen with medical charges. I was on a committee to decide, UW medical charges, and they like to compare with, what does everybody else charge? Oh, those people are charging more, so we should raise our rates. And then the next time the other people meet, they go, well, now UW's raised their rates, we should raise our rates. And it just spirals back and forth. So Middleton and Sun Prairie might see if we go up to, more closer to what their rates are, they're going to say, well, now Fitchburg or Fitch-Rona went up so much, we should go up another 100 or 200. So I just think there are consequences to this, and I prefer to, maybe think about this a little bit more and think about the financing.
Okay, well, it sounds like we should put this on a future agenda then and think about it, discuss it some more.
Yeah, so review and possible action. So I guess we can call it review. I don't know that I don't know that it needs an official tabling other than we reviewed it. We're not going to do action on it, and for the minutes, then we'll put it back on the, let's call it the November meeting.
November meeting, okay.
And maybe come with, is there what the intent is for the increase, or? Does our budget need that? I'm guessing it does. It will at some point.
Well, and if you want to, there's all the different approaches. Our budget this year went up 3.3%. So, if the explanation is to keep up with the inflation of our budget and to keep the municipalities historically, we're kind of in this curve now. When we had 2 ambulances, our run income was more than 50%, and the municipalities were paying roughly about 47%. The tables have turned now that we've got the 3rd ambulance, but that run volume and the income hasn't caught up yet. So now we're back the other way where run income is about 40%. Municipalities are paying 53%. As our volume goes up, it'll go back. But how fast do you want it to go back? Do you want to keep base rates the same and merely, just count on volume to increase on what run income is going to be? Or, option is our budget went up 3.3%. Do we increase rates by 3.3% to keep up with that? Or maybe it's establishing the goal of the base rate is to keep it at a 50% budget ratio. And maybe you use that as the guidance of what when should base rates increase. So if you have any other, if you come up with some questions, please let me know and I can get that information before November, but we'll put it on November's agenda.
Yeah, Has this ever been an issue at the annual meeting, the rates?
Because it's usually decided by the commission. Well, it is decided by the commission on what those rates are. I can bring it up at the annual meeting, as you're aware.
I mean, is it smart to do it or not? I don't know. I don't think it hasn't been since I've been on the commission, I know, but
No, it's usually brought up to this group. I think just because that's usually the budget issue at the annual meeting and is largely non-participatory. So
yeah.
Mm. Well, Chief, maybe if you could put it in November, if we could have like a couple of options, a relatively low increase in our rate and what that would do to the community payments or the municipality payments versus a relatively high increase and what that might do. And I think it's also affected by the question I asked earlier about the run volume. If the run volume continues to be high, what effect would that have on whether we raise rates or not?
Sure. Well,
and then, when the town of Madison joins Fitchburg, the part south of the Beltline, is that going to be in the next budget year or two, or?
That will, yes, that will occur in the 2022 budget, but it doesn't occur till the fall. So the 2023 budget will include that additional run income again with a, I will do a best guess. I will call up the 911 and said, how many calls occurred in this area in the last year? They'll give me those numbers. So I'll have a fairly reliable number. What I don't know, I can truly highly suspect what the payer makeup of that area is, and probably be pretty spot on. And as you can suspect, it's probably going to be a largely medical assistance Medicare payer group.
Yeah.
I know there's a large senior housing development. I know there's a lot of workforce housing in there. So I can do a little bit more research and try to project what that's going to be. But
okay, well, thank you for anything you can do. Yeah, that'd be great.
Yeah, that brings up just a quick question I had. I noticed that there's a lot of senior housing developments going up in our service area. Will that have a future impact on number of calls?
Yep, I actually did have this discussion when we met with did the budget review with the city of Fitchburg with Mayor Richardson and the city administrator, Chad Brecklin, and the finance director there, just to remind them. So, and Shannon, I think you could correct me if I'm straying, but my numbers within the next 3 years, there are 5 senior housing projects going up in Fitchburg. That includes an inpatient rehab center, as well as we were out at Oak Hill yesterday doing our annual tabletop review in November of this year. Oak Hill's long-term care facility opens up. Still a little question. Even they don't really know what that means, but it will be built. They're suspecting, I believe it's about a 60 patient bed, whether that will be a rehab for kind of inmates transitioning back to their general population, or whether that will truly be, for all intents and purposes, an assisted living center for inmates in Oak Hill. So absolutely all of those in Verona, just up the road, just on Main Street, Oakwood.
Which looks like a huge development.
Yep, it's Oakwood, right, Kate? I think it's one of the Oakwood villas that opens up. I think here in November as well.
Yeah, late fall.
So absolutely, those I've got that on my radar as well. So I did talk with the mayor about that. I mean, it's phenomenal growth. It's great that that's happening. I just want to make sure that that's on somebody's radar, that every time you build a senior housing facility, that is more calls for us, and just to plan appropriately.
Yeah. Anybody have any other business that you want to bring up? If not, next meeting is the annual meeting, and I assume that will probably be virtual again, we're thinking.
Yeah, I guess that is my question for you. I forgot to double check the date on the mask mandate. I know that drives most people's life. At what point? at what point do you want to actually get together and wear a mask or not wear a mask? Is there anybody thoughts we can absolutely do it virtually? It would just be a wider distribution and it may actually get more attendance if we do it that way. If you remember from our intergovernmental agreement update, we changed it essentially to kind of a state of the state thing. So I'll give an update on where we're at, where we're going, and then it's a budget review, but we don't actually vote on the budget anymore.
Yeah.
So it could be done.
Would you be
virtually.
comfortable, Patrick, just reaching out to the municipalities and seeing if they have a preference?
Sure.
Whether in person or virtual, and we can kind of go with what they want.
Sure. My guess is it will be virtual, but
Virtual, yeah.
I will absolutely let you know.
Yeah, I think people are getting pretty used to Zoom meetings.
We could do a hybrid as well. I know Fitchburg, the Fitchburg City Council has a hybrid kind of. We did it a couple months ago, so that's an option as well.
Yeah. Okay. Okay. Well, we'll kind of let you take the lead on that then, depending on what kind of
Okay.
feedback you get.
Okay, I will. I'll put out some feelers and find out.
Any other business? If not, I guess a motion to adjourn would be timely.
I'll make a motion to adjourn.
I'll second.
All in favor of adjourning the meeting, signify by saying aye.
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 Anybody opposed? Assuming not, we'll see you all in a month.
Thank you very much, everyone.